My name's Barbara Cave.
And my name's Tom Cave.
And we have a daughter called Rosie who's now 13 years old, and she was diagnosed with alternating hemiplegia when she was about 9 months old. Well, as a query, it possibly could be. And then it was confirmed when she was about 2. It did take a lot of hospital visits and a stay of a couple of weeks because the symptoms were so bizarre and no one knew what was wrong. The main symptoms were bizarre eye movements, and I think we had a referral then to Great Ormond Street, and it was diagnosed as something else that she would grow out of, but that didn't happen. And then as time went on, we saw another consultant who was a paediatric neurologist who had seen the condition 3 times before, and she suspected that that's what it was.
The specific triggers that we think are certainly temperature extremes, cold weather particularly, and cold windy weather tends to bring on the epileptic seizures that she suffers from, as well as the hemiplegia. And also possibly bright light. We notice that quite often if she's in supermarkets or shopping malls, where we don't tend to take her now, but often we think perhaps fluorescent lighting has brought on. And excitement and ill health as well. If she's got an underlying fever, then that could sometimes trigger seizure activity in hemiplegia.
I think even bright sunlight sometimes can affect her hemiplegic wise, and possibly overtiredness. When she has a seizure, yes, we give rescue medication straight away because they're very severe seizures. She stops breathing, her lips go blue. So we give her midazolam immediately and wait for the jerky limbs to subside and the breathing to regulate. Get her comfortable. That can take maybe between 8 and up to 15 minutes until she's really settled and the breathing's regulated, and then she sleeps for about 3 or 4 hours normally, if she can be quiet and left to rest. And then she bounces back quite well, but she might not want to eat much for the rest of the day. And then she's really hungry the next day, usually.
Yeah. So her daily medicines are cetazolamide and lamictal for the anticonvulsants, and flunarizine, which is for the underlying hemiplegia condition. And then if she's feeling poorly, she will sometimes ask for liquid paracetamol, Calpol she'll have. So those are a regular medication.
She's best supervised all the time because her walking, her balance isn't great. She can walk on even flat surfaces fairly well. She wears orthotics because her ankle position otherwise would be really bad. She has a scoliosis as well, so her walking isn't very good, but when she's not having hemiplegia, she can walk short distances, mostly indoors. Uneven surfaces aren't good, so we have to sometimes hold on to her to help with her balance as well.
But her general health she's fairly robust really. So her general underlying health is not too bad, is it? It's really, she doesn't get a lot of fevers or colds really, but obviously the seizure and the hemiplegia is enough to deal with on its own. But no, she's fairly robust.
So the hemiplegia, it's variable. It might happen every day. It might happen once every 2 or 3 days. It might happen twice a day and last for between 10 and 20 minutes. And when she was younger, she had a lot of bilateral attacks. And now that's rare. It can still happen, but it's rare. And the seizures, maybe 2 or 3 a week sometimes, and we might then have a week or 10 days or even up to 2 weeks without any, but it's mostly, maybe a week's gap. When she was younger, we might have had 3 weeks without any sometimes, but that doesn't seem to happen now.
Best we've ever had was an 8-week gap. We had an 8-week gap when she was starting a new medication. We thought that medication was the one, but then it came back to 2 or 3 weekly, so it was a temporary relief, really.
Not that we're aware of. Her communication is poor anyway, and I guess we wouldn't really know if she'd forgotten something, possibly. I'm not aware that she has lost any of her learnt abilities.
Because we should say she's quite severely delayed anyway because of the condition. She's 13 years old, but she's probably only cognitively about 2.5, 3.
Less.
Or maybe a bit less even.
Yeah.
But we're not aware that she's actually lost, as my wife says, that she's lost anything because of the... But clearly it's affected her dramatically in terms of her development.
We do have some help with Rosie. We have Hope House Children's Hospice, where she has 18 nights a year, and maybe a 1 or 2 extra when they have the space. We have... Now, she's been going there since she was about 3.5, and for the last couple of years we've had another respite centre where she goes for 2 nights a month, where there are carers there to look after her. But if she had a severe seizure and needed to go to hospital, we would have to be available to go with her. We also have a lady who comes once a month on a Saturday morning for 3 or 4 hours. She's well trained in using rescue medication, so that gives us a little bit of respite to do something with our son. And school is really good. School copes well. The school nurse has been really good, and her classroom assistant, who can give midazolam, helps us out a little bit sometimes.
We have a few informal babysitters, in inverted commas, who know Rosie and can deal with it as well. So.
Not many, 1 or 2. She goes to special school. She always has done. She couldn't have coped with normal school. Her speech is quite poor. She has a few words, and maybe she can sometimes put 2 words together, but you have to listen carefully often. It's hard to... We know what she means sometimes because we're used to what she's trying to say. And she tries to do a little bit of Makaton signing, but that's a bit uncoordinated, and it's her version, so it's not exactly right. But she can make herself known if she wants something, because she's very assertive.
And she can understand. We think she can understand a lot more than she can say. So we're pretty certain she can understand most of the things we say to her. Whether she wants to do what she's asked is a different matter. We, I think, are lucky in the sense that Rosie is a very loving and happy child, and she loves physical contact. Some people think sometimes she's autistic. Well, she's the exact opposite. She loves company, she loves people, and she loves being read to, and she loves games, and she loves singing and music. So all those things are, if you like, blessings that make up for all the difficult times, the lost sleep and the hassle and the heartache that you also have. So my advice would be you basically have to think of all the good things, and obviously the time you have with her, because that in Rosie's case, we're well aware she goes to a hospice because the seizures are potentially fatal. And clearly you know that one morning you might go in and she might not be with us anymore, so we count the time we've got with her not looking on the worst side, but realising that we've got to make the most of the time we have with her, really. And I think most of the children we've met, there are those sort of things. So you look on all those things to compensate for the bad times, and you will get used to it, and you will cope with these things because it's worth it.
And there are some wonderful people out there who've been a great help. People in school, respite carers. And I think it's about giving your child a good quality of life. And she does have a good quality of life. She's happy. Yes, she does have horrible, severe symptoms that we can't do anything about other than the medication she's on. But she does enjoy life. I would love for my child not to have to take any medication, if that was at all possible. Or to be on the absolute minimal amount that was necessary. So if research could highlight a better drug, or that would be great.
Be nice to know the mutation type, but I realise that's just something that will hopefully come in the next year or 18 months. We personally don't know what Rosie's mutation type is, although we have been warned that whatever it is, there's no sort of instant therapy. We're well aware of that. These things are very complex, but it would at least be nice to have that knowledge, I think, which we haven't got at the moment.
Well, Rosie certainly isn't aware that she's abnormal in any way. If she gets hemiplegia, she just and gets on with it. And sometimes you want to rub her limb and make things better, and she pushes you away. She's very independent, really. So yes, it's very challenging in a lot of ways, but it's very rewarding in other ways. I would think definitely.
Yeah.
It just changes your whole perspective on life and makes you appreciate all the little things. And helps you to be grateful when things are going well, and for all the help you get when things aren't.
Yeah.